now we're going to give you a little bit of an example, because we tend to focus on women in their childbearing years who are kind of transitioning in and out of having children, because that can be a very difficult time in your life. Your body's going through so many different changes, not just physically, but chemically, hormonally. And you're going from, some of you are getting ready to become moms for the first time. Some of you are becoming moms for the third or fourth time. And your life is going through so many changes, and it can be really difficult, and it can be really disheartening when you're trying to change your body. You're trying to get into shape. You're trying to lose body fat. And you're seeing little to no progress because you just don't know where to start. You don't know where to go. So I'm going to give you a little bit of an example of what we've been utilizing, what Megan's been utilizing in her life, and how that has led to her being able to train with momentum and understand what is the best phase of training for her to be in to get herself into shape once again, so that she can feel strong, so that she can feel confident in her clothes, and so she can feel confident in her life. So here we go. So the example we're gonna give, and I'm gonna help do seasonal training for the seasons of your life, postpartum, one child. Now, postpartum is forever. If you've had a one child once, you'll always be a postpartum female, and those are gonna be things you're gonna have to deal with, whatever changes have happened in your life because of that. And you have to find a way to make this work in your life so that this becomes an integral part of your life, so you can continue to be healthy, so you can continue to be strong, and so you can continue to feel confident in your body and in your clothes. And we want that for you so bad. So here's kind of how it works, and here's what might look like in your life. Usually once you are cleared to return to exercise, we're going to be eventually releasing programs that talk about, working in and out of pregnancy in the early phases. But for now, usually we get cleared for some good exercise in between that 2 to 3 month postpartum range. And sometimes you can go as early as 6 weeks. Sometimes that's not always the best, but it just depends on your certain situation and what your health circumstances allow. But let's say you're 3 months postpartum. You have never really engaged in a training program at all. You're not used to cyclical training like we do in the different seasons. You've never been in a bulk. You've never been in a recomp. Maybe the only thing you've ever done is fat loss related type of training. We would recommend that in that cycle of your life, it may be, and I say maybe, there's always different types of circumstances, may be most beneficial for this female, for this new mom to work in her way into her first bulking or get strong phase of training for a couple reasons. One, usually you're breastfeeding. And if you're breastfeeding, that can make it extremely difficult to work into a fat loss phase, because you naturally need to be taking in more calories to successfully breastfeed. If you decrease your calorie content too much for too long, this can affect your milk supply. And so that may not always be recommended to jump into a fat loss phase. So we recommend jumping into a bulking phase. This is going to help you actually raise your metabolic rate. If you're able to raise your metabolic rate, you're going to increase your body's metabolism and its calorie burning capabilities. As you increase your body's calorie burning capabilities, you're going to start putting on a lot of strength, which hopefully you have maintained throughout your pregnancy, but you're going to start packing on some more muscle. And that's a great opportunity for you to really start enjoying the gains that come from being in the gym, being able to hit personal records on all of your lifts, and be able to see the benefits of strength training in the gym. Strength training will really help you drive the results you want as you move further along in the process of being postpartum. Because you're increasing your metabolic rate, this is going to greatly assist in your body's ability to lose body fat, especially some of that baby fat that you accumulated during pregnancy. Some of it will naturally come off a little bit, but if you go into a bulking phase and you've never been in one before, you're going to benefit greatly from this, and you're going to start losing some of that body fat naturally. Once you have gone through a strength training phase, it it can be very beneficial for you to move into a recomposition phase at 6 to 7 months post-pregnancy. If you're at 6 to 7 months post-pregnancy, you've basically lost, like, a lot of the natural baby fat has come off. You've increased your strength at this point. You've raised your metabolic rate. And now as you enter a recomposition phase, you're ready to hit the best of both worlds. Put on some strength as well as start really burning the fat. And you can decrease your calorie intake a little bit. Again, this is not always recommended if you're breastfeeding. If you are breastfeeding, in the macro calculations form, I ask you to put that in there so that we can take into account, because what I will do is I will take your maintenance calories, I will put you into what we call a slight deficit for a recomposition, and then I will add back in the average of, it's usually somewhere between 200 to 300 calories for a breastfeeding amount. Now, in any circumstance, you should always consult your obstetrician or your primary care physician or your chiropractor, someone who is trained to be able to help you make this transition. You should always consult them before engaging in any serious activity if you're breastfeeding or if you're pregnant. But we just wanted to know kind of how we make it work. This is what Megan does, and this is how she's kind of worked on transforming her body. So if you work into a recomposition phase in that 6 to 7 month phase, you've built on a lot of strength. You're ready to start adding some muscle endurance. Naturally, your baby is also getting heavier, and so having some muscle endurance to carry them around everywhere is going to be extremely beneficial for you. You'll start to take off some more body fat. We decrease your calories a little bit so that now, since your natural baby fat that would have come off anyways is started to fall off, now we're going to start carving away at other body fat that may still be there anyways. This is very optimal for you as you move into this training phase, because you will be set up for success to move into the fat loss phase. The fat loss phase, let's say you get to that 9 to 10 month mark postpartum, and you've worked through a bulk, you've worked through a recomp, coming into a fat loss phase of training at 9 to 10 months postpartum is optimal, because you have really basically all of the natural baby weight has come off, which we've already talked about. And now it's time to really start thinning out. It's time to start getting toned and focusing on bringing out this muscular body and this muscular woman that you may have never seen before, because now you've just spent a lot of time putting on some muscle, getting stronger, and increasing your overall function. So as you move into a fat loss phase, usually the 9 to 10 month, not 9 to 10 month, but usually around the year mark is when some women, not all, it's 100% dependent on you and what you think is best for you and your baby. Usually a Megan naturally starts to tend to reduce her amount of breastfeeding. When you stop breastfeeding and when you finish breastfeeding your child, this actually allows you to really get into a calorie deficit and a strong calorie deficit so that you can focus on that fat loss phase. Because of the varying circumstances, this may be an optimal time for you to move into a maintenance phase at that 9 to 10 month range, so that maybe when you hit 12 to 13 or even 14 to 15, or whenever it is that you're ready to stop breastfeeding, to move into a fat loss phase so that you can drive the results that you really want. Because once you've raised your metabolic rate from the strength gaining phase and the recomp phase, you're gonna get all the benefits like we've talked about from the fat loss phase, because you naturally have a higher metabolism, you have more muscle, which means your body's gonna be burning more calories, which means you're gonna get so much more out of the fat loss phase. Once you've worked through all 4 cycles and you're ready to take a break, this works really well to help you get back into what we call the maintenance phase. The maintenance phase of training is going to be great after those 3 and you're ready for an overall mental break. The mental break in the maintenance phase is perfect because it helps your body find a set point. When your body finds a set point, you're able to maintain the transformation and the gains that you've already gotten. This is pivotal to your long-term transformation process and getting the body you've always wanted and finally feeling confident in your clothes.